Hi ladies, recently I've seen few women who have endometriosis and come back with recurrence, come back with still having the symptoms. So what is endometriosis? Endometriosis is a disease where the lining of the uterus, the inside part of the uterus, the cells called the endometrium is found outside the uterus. Okay, adenomyosis is a disease where the cells are found in between the muscle of the uterus. Okay, so if you have endometriosis, if you have adenomyosis, the main symptom number one is painful menses. When you have menses, you have severe pain, very severe pain, and it lasts for sometimes starts before menses and then it will continue after menses. The other one is heavy bleeding. Okay, bleeding will be very heavy, and when you have intercourse with your partner or husband, you have pain, difficulty to get pregnant, and things like that lah. Okay, and also when you pass motion during menses, you have pain. This is called tenesmus. So how do we diagnose this? Diagnose from the symptoms, from the pain, from the heavy menses and all that. Then we do a pelvic examination. We examine the abdomen to see whether there's any mass or not, whether the uterus enlarged, whether there's any cyst or not, and then we do a pelvic examination. We examine from down to see whether your uterus is, the size of the uterus, and see whether there's any growth, most likely a cyst lah. Okay. After that, we will do an ultrasound to confirm the findings. But sometimes when we do ultrasound, we don't find anything. Okay, nothing will be there. So, but the symptoms are there. So, if in this kind of cases, we have to do a laparoscopy. Put a camera inside the abdomen and see the part of the abdomen. When we see that, we see brown color dots. Most of that is endometriosis. Okay, so if you have a cyst, we have to remove the cyst. Okay, regardless you're pregnant, you're trying to get pregnant or anything, you have to remove the cyst. If your uterus is enlarged, we see first. Okay, if you're like above 40, above 45, you have children and all that, and you have endometriosis, most probably we ask you to remove everything because you have to remove the uterus and the ovaries if you have this problem. If you don't want to remove, maybe we can treat medically lah. Okay, most important thing you all must understand that endometriosis is a hormone dependent thing. As long as you have menses, as long as your ovaries are there, it can recur, no matter if you have done surgery for it or not. This is very important. So when you have endometriosis, you need long-term treatment. Okay, long-term treatment and follow-up. And this disease can be easily controlled with hormonal treatment. Okay, so those ladies who have had endometriosis or who has not seen a doctor for this problem, please come and see us for examination and to diagnose the problem. And the most important thing is, once diagnosed, you have to have treatment for a long term until either you take out the uterus and the ovaries, or until you reach menopause lah. Okay, because after menopause, most probably the problem will settle because the hormonal levels are less, but still maybe you have to monitor. Okay, so ladies, if you have endometriosis, please come and see us. If you have symptoms of pain, painful menses, most likely you got endometriosis. No woman should suffer from painful menses, so please come and see me. We do a thorough examination, investigation, and also this can be treated. Okay, thank you.